going to introduce Helen Clayton, who is the Manager of Student Services at the Students Services and Wellbeing Support, so SWIS, who's going to talk us through including our students, student access plans and designing for all. Over to you, Helen.
Thanks so much, Charlotte. Hi, everyone. I can be heard okay, hopefully, and please signal if not. I'll keep Charlotte because I'm on my laptop, which is annoying. So I have a very little screen to work with. But Charlotte will indicate if we have any technical issues. Thanks so much for coming to join us today. I am going to just give everyone a heads up that it's been a while since I've run this session. My colleague Lockie has been delivering this session for the last few semesters. So if I'm a little bit rusty, please forgive me. But I think the most important thing about coming along today and you sort of wanting to hear more about our student access plans and reasonable adjustments and the ways that you can best support students is really just about engaging in conversation and discussing things. So I'm going to try and move through the first set of slides, not too quickly, but like just fast enough that we get that good sort of session at the end to be able to engage and talk to each other. If you have any questions at any point, please don't hesitate to signal those and I will do my best to answer them. And if I can't answer them straight away, I will come back to you. So just flicking if my thing flicks. Just to start off our session today, I would like to acknowledge the traditional owners and their custodianship of the lands on which we meet today, the Yagara and Turrbal people, from where I'm sitting here in St. Lucia in a very balmy workshop A. I'd like to pay my respects to ancestors and their descendants who continue cultural and spiritual connections to country. And I'd like to acknowledge the land that we're on and the many, many years of learning that have been undertaken here, and education and sharing and storytelling. And I think that like a little bit under a week out from orientation week and welcoming all of our new students to this amazing land, which we get to work and learn and come together, is a really exciting thing. And I think it gives us time to reflect on the history that is here. So today I just want to run through a little bit of an understanding of who the students are that we support within the accessibility and welfare team within student support and wellbeing services. And really the student journey to getting reasonable adjustments in place and some of the complexities that might sort of come up as a part of a student's journey, not the journey necessarily that they have to go through to get the adjustments, but sometimes that can be challenging, but also the journey of like the different complexities that students might face with their circumstances or with their condition or with their disability. We'll talk a little bit about some of the common adjustments that you will see in student access plans, and we'll have a look at some SAP case studies together. And that I think is the really important part of the session where I want you to feel really relaxed and comfortable to ask lots of questions, or if you're feeling unsure about reasonable adjustments, that the team that are with me today are able to sort of help with navigating some of those challenges. And then also really just about knowing that you can connect in with us and that we're here to support you when you are sort of working with reasonable adjustments. So who are our students? So our students are really the core students who are coming to us for reasonable adjustments are coming to us for a number of different reasons that you can see on the right-hand side there. The students' policy and procedure for reasonable adjustments outlines that we will support students who may be experiencing any number of those listed here. So students with a disability, a student who might be a carer or who are experiencing domestic, family or sexual violence, students who have ongoing commitments to religious observance or elite athletes and performers, our ADF Australian Defence Force reservists, and as well as students who might be experiencing exceptional circumstances. So that last point's quite a broad one, but they're the students who, for example, their home country may be not Australia, and there may be some civil unrest or war or certain things that are happening in that country which could be creating undue stress for that student. And so they may seek support from our services for some reasonable adjustments to support them navigating how they're going to sort of manage their studies as well as manage the stress of what might be happening in their home country where their family and friends might be still residing. The reasonable adjustment students policy and procedure it's really framed from the Disability Discrimination Act and the Disability Standards for Education. So legislatively, we are actually, bound to be supporting students who need reasonable adjustments to be able to equitably study alongside their peers and to really support students with removing barriers to education. Just on the left-hand side, in terms of our numbers, so this is purely just student access plans. We have another vehicle for communicating reasonable adjustments for exams, which is our alternative exam adjustments. But ultimately, they're all reasonable adjustments, depending on whether it's a student access plan or an exam adjustment. So you can see that we've had the number of students who are actually reporting that they have a disability in SciNet is increasing year on year. We know that is actually a sector-wide sort of trend that we're seeing. We haven't yet got the data for 2025, but we know that this is something that is increasing. More and more people are actually reporting that they have a disability, but we're not actually seeing all of the students who do have a disability. So there will be students who come to see us for a SAP as per the reasons on the right-hand side, where they may not be declaring a disability in SciNet. But what this slide's really outlining is that the majority of the students who we are supporting with reasonable adjustments will be coming and getting a SAP in place and will be declaring that they do have a disability on SciNet. So this slide here is, it's a little bit old, but it's from the Access Data Insights series. So this is a sort of a national picture of students who are declaring a disability in Australian higher education. So this is cumulative of all of those declarations that happen on SciNet. And really, this slide is just to demonstrate what I alluded to earlier, where we are seeing, like across the sector as a national trend, an increase in students who are coming and declaring a disability and needing additional reasonable adjustments. And just that some of those top avenues of disability really are within our space and within, again, the sector. Neurodivergence and mental health are generally the two top conditions. Neurodivergence isn't captured very well in terms of the indicators that the access data does display here, but we do know from our experience of working with students within the team that is a high proportion of the students that we're supporting. And I'm not sure if any of you online have heard about our Neurodivergent Hub, which also sits within the Accessibility and Welfare team. That is an initiative that has been specifically developed and set up to support neurodivergent students at UQ. And we are seeing an increasing trend in attendance at those programs as well. So just a little bit on the student journey now. This little slide here is really, it's a more general sort of patient journey through diagnosis. But the slide is quite indicative of the pathways that students might have to take as well to be able to actually get like the support or a diagnosis or the relevant documentation that they might need to support getting reasonable adjustments in place. And so we like to sort of talk to this slide just to I guess ground some of us who might be looking at reasonable adjustments as a relatively simple process is that there's a lot that goes into it for a student, and also for a student or for anyone who is needing to try and seek out a diagnosis for a condition. It can actually just add to the stresses that are already there. So when we're thinking about some of the students that we're trying to support through their education journey, if they're also trying to navigate this complex medical system as well to actually get a diagnosis, to get more support in place, maybe to get, NDIS funding, there's just a lot that can be going on outside of the students' day-to-day while they're at university. And just a little bit more here on the diagnosis. One of the things that we do see quite a lot with students is we'll have students present to our service who might be needing, they recognise that they need some support, but they're not quite sure what that is yet. They may have been to the GP, and the GP might actually outline on the medical documentation that, they're having trouble concentrating, or it's taking them longer to process content, or there could be a couple of things that the GP is noticing. Maybe it's fatigue, or maybe it's, undue stress, or a number of different conditions that a GP can actually identify and actually write down on medical documentation and diagnose. A GP isn't able to actually diagnose some of the other, sort of conditions that a lot of our students might be experiencing and being diagnosed with. So ADHD is a very common condition that we will be supporting students with, that again takes quite a long time, and as you can see on the screen here, a fair bit of money, which we know our students don't have access to always, to actually get that diagnosis. We can support students who do come to us having seen a GP. They're not getting supported, but we do understand as well, if we reflect back on that previous slide with the intricacies of going in and out of the different medical systems to get a diagnosis, plus adding in the wait time and the cost of actually having to seek out a formal diagnosis to get more support, there are some additional barriers and challenges there. So once our students have actually made it through our intake form to have an appointment with us, they will be meeting us in the picture here, not necessarily in that picture, but this is one of our consult rooms, and so this is one of the sort of settings where our appointments will be held. We are this semester and in 2026 undertaking a new intake form or a booking form for our students, and we're hoping that will ensure that our students get a little bit more refined support as they're coming into our service. And we always know at the beginning of the year and beginning of semester, but particularly at the beginning of the year, we'll get a much higher volume of new to service students, and so that takes a little bit of extra time and care to get them set up for their academic journey. In addition to this, part of that might be creating the student access plan. So there could be a number of different things that we will be doing to support the student. But one of those things could be creating the student access plan, which is the vehicle to which we will communicate the reasonable adjustments to all of our course coordinators, and to all the relevant people who might need to be involved in putting in place adjustments for that student. This little screenshot here is actually a snapshot of our most recent SAP template. We have recently been going through a SAP reform within our team, and if you are familiar with our old templates, this will be the new ones that you'll see coming through, and I'll talk to that shortly in some future slides. So once we have really developed that SAP, and we'll develop the student access plan with the student. It's very important that the student is a part of that journey and that they're actually contributing to what those reasonable adjustments will look like for them. But the role of the advisor in the setting up of the SAP is also to take into consideration some of the functional impacts that the student might be experiencing as a result of their condition or of their circumstances. And we may also be wanting to take, and the team will also, be taking into consideration some of the academic elements and the learning environments and all of the different factors for the courses that the students actually undertaking for their program. And so there's a bit of a reason why we will do the student access plans each semester, and that's just so that we can make sure that we are really looking at what's happening for the student this semester. Has their course changed? Has their program changed somewhat? Are they in a program where they're starting very much in a coursework environment and then their learning environment changes into something a little bit more practical? Is there a placement element to it where they'll be going, off into other learning environments that are outside of the university? So there's a number of different things to take into account, and we do take those into consideration when we're meeting with the student at the beginning, the very first time, when we recognise they need adjustments, but as partly our system, but also making sure that we're doing that due diligence to meet the course requirements each semester, that we'll go through that review at the semester mark. So the student access plan for us on the left-hand side goes through the wonky course sort of coordinator and course coordinators commenting on the reasonable adjustments that are in place. And I think that that's just sort of representative of the fact that there might be a little bit of liaison back and forth as well between our team and the course coordinators at that point. And we invite that liaison as well. We don't expect course coordinators to always be fully comfortable or confident with what they are looking at or reading in terms of the adjustment. And that discussion point is really important to be had. Once the SAP is sort of finalised from that course coordinator perspective in terms of we're all good with the adjustments and we know what we need to do to best support this student, then the student will receive a notification via the system that those comments have been put in place by the course coordinator.
We just had a question on that last slide.
Yep.
Do the email notifications get activated course by course, or do you wait or is it still rather than waiting for all course coordinator comments to come through? So does the student receive sort of 4 comments or just?
I think that the student will receive the comments once all 4 course coordinators, or the number of courses that the student's enrolled in is when all of those course coordinators have made comments, that's when the student will see those comments. The SAT will sit in like a 4 or 5 different stages. So when it's with us, it goes up to what is known as like submitted, and then it comes to goes into a requested stage when it goes over to the course coordinators. So once it's in that requested stage, it could sit like that. The SAP is still active as well. Like at that point, once it's left us, essentially, the adjustments really do need to be put in place. But we do encourage all course coordinators to make their comments on the system so that we can make sure that the student is aware that those comments have, the adjustments have been acknowledged. But it does rely on that to be able, those 4 comments to be able to push it from requested to pending. Once it's pending, we can close it off on our side as a finalised SAP.
Okay, thank you.
Here's an example of some comments. You can see that my colleague Lockie has been in here, which is great. So this is just an example of the types of comments that we might see from a course coordinator. And really, it's just, I guess, to be comfortable that you can acknowledge with the student that, like, yes, let's have a conversation about some of the requirements within this. Let's have a conversation about what some of the adjustments are specifically requesting, or can I make you aware of some of the things that are already available? For example, like the recorded lectures, and things like that that are actually already inherently within the course. Our team won't know what's inherently within the course and the intricate details of that. And we will do our best to ensure that we put in place adjustments that will be, appropriate for the learning outcomes and the learning environments and the inherent requirements. But sometimes it will take a little bit of a discussion just to sort of talk about what those adjustments might look like. And they might not necessarily be what we have articulated, but they could be something different that we hadn't really thought of for that particular course or for that learning environment. So there really sometimes is a little bit of discussion and back and forth to figure that out. So just moving over to common adjustment types. So this was a piece of work that my colleague Lockie did, and he reviewed a number of SAPs across a single course in 2023 and in 2024. And the exercise here was really to kind of prove with data what we knew in terms, what we suspected anecdotally in terms of where the most common adjustments were coming out. And that was really like just to give ourselves a substantial number of access plans where we could identify that, the big actual adjustments that were appearing quite frequently in access plans were in fact true. So it just shows that, extensions were really starring as a common adjustment type, as well as absence or breaks and classroom participation. And as you can see, it moving down the list there. That was a health course. So there could be some, I guess, intricacies or specific learning environments or impacts for that particular discipline area. But it was a good representative program to look at. Okay, and just really having a look. Oops, sorry, jumped over that one accidentally. So just having a look in a little bit more detail, some of those common adjustments within the single course. So eligibility for extensions, what the absence and breaks really look like. So some of that might be around alternative assessment if participation is assessed. And that can be quite a challenge for a student who might have fluctuating health condition where if they are required to be in attendance and or participation is being actually assessed as a part of that course, are there ways that we can alternatively assess that student in the event that they happen to have missed some of that participation that will be assessed? It could be just really about how the student could make up or catch up on any missed content or materials, and needing to leave, have breaks or leave the room. A lot of these have been reviewed, so it'll be really interesting once we have sort of had our new reform wording in place. Potentially, I'd probably like to give it a couple of semesters, so this might be an exercise for the back of 2026 or early 2027, just to revisit what some of those common adjustments look like. Okay, just a couple of slides on the SAP Reform Project. So the SAP Reform Project it's a piece of work that's been underway for the majority of 2025 I guess, in its activation into what it looks like now. But it has also been a piece of work that has been undertaken since about early 2022. So there's been a high volume of sort of discovery work and consultation that's been going on to review how we actually are creating and delivering and supporting students with reasonable adjustments via SAPs, but also how we're actually communicating those to our academic and school staff colleagues, and how we can better support each other in that whole process to better support the student. So you'll see, as I said earlier, a little bit of a difference this year if you've seen previous SAPs. So newly developed SAPs, or SAPs that we have significant adjustments in that would typically be rolled over. They're going to be provided in a new structure this year, and they're going to also follow the wording that has been developed within the SAP template and for the reasonable adjustment. So the new template makes it explicit so the right and responsibility, of course coordinators to provide guidance on contextual limitations of recommended adjustments. And you will be looking at the new SAP template when we go and do our breakout exercise shortly. So as I said, we do have some consistent wording for included adjustments. There's a number of adjustments, and some of that data that I shared around the health analysis that was done, that was just really highlighting that actually we are saying the same thing in a multitude of different ways, and there's a way that we can say that just using, one sentence as opposed to sort of free form text. So it's really just about tightening up the wording around that and just making it a little bit more consistent and easy for our course coordinators and our staff who need to actually be looking at all of these SAPs as well to best support the student. So there's a new process for course coordinator consultation outside of the student management system. So this will be really about the team identifying when an adjustment might impact or change how a class or a tutorial or an activity within the learning is actually normally delivered. If a reasonable adjustment is going to alter assessment or how that's normally completed. Might also require the changes to how a student participates in an activity or how they might participate with peers. And then there could be things around time, equipment, staffing, and different modes or learning environments, and other things around professional safety or skill-based learning activities. So that consultation is incredibly important. It always has been important, but we're really trying to call it out now to make sure that everyone's feeling comfortable and confident around being able to engage in discussions around reasonable adjustments and some of the factors that might actually, when we're putting in place a reasonable adjustment, some of the factors that might need to be considered from those courses, those learning environments, and so on. So I'll just move on. Our future changes, so SAPs which only had requested consideration for extensions will not be continued. So I'm not sure if everyone is aware, but there's been a systemic uplift to the assessment procedure, which means that all students who are registered with our service within accessibility and welfare of student support and wellbeing services are now eligible for 7-day extensions without additional documentation. And so due to the shift in the extensions process, that means that students are actually going to be better supported without having to come and get a SAP from us, and they can immediately access their extensions. This is going to reduce the number of SAPs by around 15%. So reflecting back on a few slides and seeing the impact of how many extension mentions, I think it was 97% in that analysis that was done, there will be a significant reduction of whole student access plans as a result. During this year, teaching staff can expect to see student access plans in both old and new formats. So the team's going to be working across this year to transform the old format SAPs to the new template. It's operationally impossible for us to request that of the team ahead of semester 1 starting. So we've decided that all new SAPs and those with significant adjustments will go into the new format. And 2026 will see school by school consultation to classify identified adjustments. And that is going to really be with a view to reduce the amount of consultation that we need to have on individual levels. So we really want to refine into the discipline areas across the university and really understand and make sure that we are articulating and delivering adjustments that do, sort of sit within those discipline areas. So yeah, school program contexts, and then maybe that there will be some adjustments where things are possible within certain schools or program contexts, but not in others. And so we just want to really highlight some of those intricacies that can come up as a result of reasonable adjustments. Sometimes an adjustment that we'll put in for a student studying in one program is something that we just couldn't put in for a student studying in another program. And so it's really just about identifying those core discipline areas. Okay, it is 1:59, so I've talked probably for longer than what Lockie suggested I should. But we're going to go over into the breakouts now. So forgive me if I brief this out a little bit wonky. There is a Padlet. There is a link on the screen now, and that Padlet contains an example student access plan. It's not a real student access plan. And that student access plan is for our student Lockie. And our student has got a number of different reasonable adjustments within that plan. What we'd like you to do in your breakout rooms, and I hope my colleagues Ben and Anna are on the screen as well. Yeah, that's great. We'll sort of just, I guess, this is really the time just to talk about the reasonable adjustments that are in that plan. Have a think about like a course maybe that you may be teaching or responsible for this semester, or you can like use an example course, and you can have a think about some of the things that you might need to consider as a part of the reasonable adjustments that are in that access plan. There's one slide I'm just going to flip to, which might help me articulate that a little bit better. So we're going to do case study A all together. So everyone will be looking at the same SAP, and then just have a little think about how you might respond to that SAP. What changes will you make to your course and teaching? And are there any like negotiations or consultations that are needed to make this work for your course and for your students? And how you think you might do this? And then again, really thinking with that universal lens, like actually, if I'm going to make an adjustment for one student, is this actually something I could do for all students? And then we wouldn't need to be making it for one. All right, I think, Charlotte, is that clear? No one's like logging off.
Only for meetings, so you're all good.
Okay.
Not because of your description of the activities.
Excellent.
That's wonderful. So we've shared the Padlet link in the chat. If you wouldn't mind opening that before I send you to the rooms, we're going to send you to the rooms now. And Chris has asked, are there limits on those 7-day extensions, e.g. a number per semester, or exceptions for assessment marked in course profiles as not allowing extensions like exam or best 7 of 10 in a class assessment?
Yeah. Yeah, absolutely. Like the extensions change is really the first instance is if a student has a medical document registered with us, if they're registered with our services, they're entitled to apply for up to 7 days extension. But as with everything, it comes back to what is the assessment item and what is reasonable in terms of an extension. So the key to the wording really is up to 7 days. If you have a weekly quiz, you can't possibly give an extension for 7 days. That's not going to be good for the student either, because they're just going to snowball all of their weekly assessed quizzes into the next one, and then potentially into the next one. So they're really it's really down to the schools to be able to make that decision as what's important in terms of meeting the objectives of the learning outcomes and the assessed item there, but also acknowledging the extension for the student. There are other ways. There's sort of three tiers to applying for extension. So like the registration gives the student access to the first extension request of up to 7 days, without providing any documentation or evidence because we know that they're already registered with our service. The second extension request requires them to provide some documentation to support that additional extension request. But as with any extension request, it really comes down to what is the actual assessment item? Is it pedagogically justifiable to be able to provide an extension for that period of time or for less, depending on what the item is? So I think, it interlinks a lot with the, maximum allowable extension of 28 days as well, but it's really about adding some flexibility into the students not needing to have certain documentation to have that extension, reducing the volume of SAPs that we have, empowering the school to know that they can, provide an extension of up to 7 days on that first request, and then up to whatever it might be being requested on that second request. And then on the third request, the student will need to do a little bit more in terms of completing some documentation, which will outline what their plan is for being able to actually meet that assessment item. So that's when you're really pushing up into the really long extension periods. I hope that answers that question for you.
Yes, Chris has said thank you, so I will take that as a yes.
Okay.
And then, yeah, somebody has provided further information. Okay. If everyone has the Padlet open, I will now hopefully send you to your breakout rooms. It's been a while since I've used Zoom, so let's see how this goes.
Great.
I can see people leaving. That's good, as into the breakout rooms. Okay. The only thing I've got, Anna is definitely in room 3. The only person, who was your other staff member, Helen?
Ben Pritchard.
Ben Pritchard. Okay, he's in room 2, so that's all good. Okay, would you like me to send you to room 1?
I can go to room 1, and that's it. That's good.
And then how long would
I
you
can
like
just
me to leave
join.
you there?
I
Okay.
don't know. Should we should we just do like 10 minutes to 15:15 or something?
Yep. To
And
15:15.
then
All right.
come back because it's 1:30 to 2:30, isn't it?
Yes.
Okay.
But we need to finish 10 minutes to the hour.
Oh, so we need to finish at 20 past?
Yeah,
Okay.
if we
So
can. But you can go a little
yeah.
bit over the night.
Yeah. Okay. We'll go to 15:15
All right.
then. Yep.
All right. I'll shut it at 15:15.
Thanks.
All right. I'll send you to room 1. Not sending you. Why isn't it sending you?
Okay, so I guess really now it's just a very quick opportunity before we wrap up. Were there any sort of key points or questions or considerations from that session? And I think we've got maybe a minute or two if anyone would like to speak up.
I will. Why not? So my thought is that it's very much dependent on the learning outcomes. So that the way you respond to this would depend strongly on whether the point of the activity was for a student to work with others, or whether it was demonstrating understanding or working through a process. So, yeah.
Yep. Absolutely, Chris. Thanks for that. Like, it's super important to acknowledge that there are so many intricate different learning environments and conditions that sit around, the courses that we run, and that there will always be different things to consider for what those reasonable adjustments look like. And our team are really happy to help out with some of those if you're getting stuck. Any other thoughts, comments?
I can share because I jumped through a bunch of different groups that there was a sort of a resounding yes that the changes for one student might actually help all of the students. And I also will dub in another question that I heard in one of the groups when I was there was what is the responsibility of the course coordinator to enact these requirements on behalf if it's other students. So for instance, if other students are putting a student on the spot or calling them by their name or doing those sorts of things, does the course coordinator have a responsibility to sort of prevent that, or is in those instances is it okay? So just that was a question that came up.
Okay. Yep. Yep. Thank you. Sorry, that last question was quite long and detailed. Do you want me to respond to it now or not?
No, it got
just
answered
an
in the group,
observation.
but that was just
Okay.
an observation of an interesting
Yep.
question. Yeah.
Great. Okay. Yes. In our group, we had quite a nice just discussion around the plan as well. So, okay, I'm going to close off because I know the session is going to end soon and you'll have lots of things to do. So look, this is really just a slide around, what support's available and any next steps. So this is the accessibility and welfare team. That's our mailbox there. So if you have any questions, you can reach out. And I invited lucky group number 1 that if they had any questions directly for me, that they're more than welcome to reach out. Feel free if you would like to. There's a number of different resources available here. And if I flick, and that's the last slide, which is our accessibility and welfare team slide again. But I think you'll get all of the resources from today. Thank you so much for coming along. Really appreciate your time. I hope it was useful, and happy to continue discussions if you feel that would be something you'd like to do.
Really helpful. Thank you, Helen. And Steph, the wonderful Steph who's on the chat, has deployed the poll. So if you could please give us some feedback on this, that would be really useful. We do take this and improve our sessions for next time. So it would be very valuable. Thank you. It also informs what sessions we put on during Ready to Teach Week as well. So thank you very much. Thank you, Helen.
Thank you.
Thank you, Ben. Thank you, Anna. Lovely to have you here.
Thanks, Charlotte.
And thank you, Steph, and thank you, Emily Marcombs.